Hello, welcome to Renew Education. This is another case study. Hopefully you've watched a few of these and you're starting to understand what's going on with the treatment assessment. This is a very good case to look at critically. We have a lot of destroyed teeth. This is a dry mouth case. Key here, dry mouth does this. As well as neglect and home care and everything else. But maybe that's the tipping point, is the heart medications and that stuff. So we're only going to talk about the upper here, but I'm going to point out here, you do not want to do this case because of the combination syndrome setup here if they don't agree to doing the lower. I'll say that again. Do not start this case without them agreeing to taking those lower teeth out in the front. And the reason why is that when you only restore the upper without taking out the lower teeth here, that prosthetic, whatever you do, doesn't matter which prosthetic, you're probably going to be doing implants, doing 4 locators, 6 locators, all on 4, hybrids, whatever you do, it's going to be expensive in the top. And it's going to be completely offloaded by having a combination syndrome patient in your chair at the end of the road. And this, if this takes 8, 9, 12 months to do, and then they can't function, and you didn't tell them that they couldn't function, in this scenario, as a combination syndrome patient, you're really going to look bad. It's really not going to be pretty. And so I make sure I talk about that. And this is the reason why it doesn't come up often, but this is why I have combination syndrome here, for sure. If they're set up with no posterior in the back, even if they have the first premolars, I start to rate the combination syndrome problem here. So I know that I'm going to warn the patient gets the treatment worksheet or assessment worksheet, that they understand, at least they have a I told you so document with the videos that I put out there online to explain each one of those characteristics that I'm rating them at. So that's the only part I'm going to talk about. The bottom is that they have to agree to something on the bottom. This patient was a great patient, or is a great patient where he understands, like, just get rid of all the teeth because they're all under the same situation with dry mouth. So once you explain that, what's the point, you know? So we did a combination of things here. I believe we started putting implants on the bottom as we were taking the teeth out on the top, just so we had something to give the patient when we did take out the lower teeth. So we'll talk about the lower teeth later. So let's talk a little bit more about these upper teeth here. You can see there's really nothing to save. We have our 50-50 rule in place. This is hopeless. This is going to be hopeless. It's got massive decay across all those. There's massive decay right here. You can't see it that well. But we're into our 6 teeth or less rule, and now it's just better. The patient could get a better function, everything else, and have more affordability to use for the bottom if they choose. But you want to advise them that there's that, you know, if they want to do individual teeth, it's almost impossible because of the amount of bone attrition due to where the sinus actually ends up. And you can see here, this is what's interesting about the case too, is you see where the history is probably from over here is over here. Just this is the lagging behind this one. So when you look at the first molar area in the sinus area, which would be about right here, you could see how much bone you actually have remaining. So there's not a lot. So if I go more anterior, it's very faint bone, very nothing bone, and going back, it's just as bad. There's really not a lot there. So if you go to the other side now, over here, you can see that those roots really went up high, and whoever did the extraction probably didn't do an atraumatic extraction on the other side and pull that interseptal bone away with the tooth. I do see that quite a bit from maybe some of the older doctors. Most oral surgeons that do this type of extractions kind of do a little bit more finesse. They just separate the roots out and take them out. So you do a little bit more where you don't rip apart the interseptal bone. But I do see that there's more of a trend where maybe doctors, general dentists are not doing as many extractions as they normally would. So this is pretty straightforward stuff, but here's the question. Do you recommend a graft here or not? Well, I do, simply because he's going into a full arch scenario. And when we look at a full arch, I would love to get an implant back here, as well as the implants up here in the first molar or first premolar and the canine positions. So if I do that, I know I'm pretty solid with bone across here, simply because the tooth has maintained as much bone as it can across this area here. So the question mark is not any of this. The question mark is, how do you now deal with the attrition of the bone on this side? It's very thin bone, so the really only thing that you can do if you're trying to get implants or anything in the back position. So let's look now at the first premolar position. Doesn't look terribly good, but it's possibly you could still kind of work with that. When you go into the second premolar, which is right about here, that's very, very thin bone. So that's not very good quality bone, but also the volume across is not very good at all. And then when you go into the first molar position where he's got little root fragments, you pretty much have lost all of that bone height there due to the disease in the perio. So here, you're really stuck with the sinus lift. At least there's some bone here, so I like having something, and it's actually a little more than you think. So it's about 5 millimeters. So here's a case where I'd probably recommend doing what we call a sinus bump, or a double bump actually. So you could do an immediate placement with a sinus crestal approach sinus lift and bring it up and do an 8 millimeter by 5. So you could do a lateral, of course, and then you bring bone into the second premolar area. Maybe not all that necessary. So here I would recommend the sinus, whether the crestal approach, where it's you can do the water method. I don't really do that anymore, but you just peel up the Schneiderian membrane and get your graft materials, and then you cork it with the implant. So that's how I would handle this case. If you don't feel comfortable doing sinus lifts and immediate placements that way, what you could do is do a small sinus bump and bring it up to, like, say 8 millimeters. You maybe bring it up to about this height here. Let's just double check that. So from here to here, we should be about 8. Yeah, that's 8 millimeters. So you want to do that. You let that heal for about 4 months. So if you let that heal for about 4 months, now you've got bone growing in here, and most of that implant, now you can go for a 10. So what you do, I call it a sinus secure is what I call it. That's my own term. Sinus secure this, where now it's, you now can put a 10 millimeter implant in, and you still got your width that's really good. You got more mature bone that started in the sinus to now elevate the sinus level even higher to accommodate that, and that would be a really, really good scenario. So now you saved yourself in this particular area. So you have an implant here, right? That's adequate for holding on, whether it's for a hybrid or a four locator case. And then you can do the other one over here. So let's look at that canine area. and now you've got the thin facial plate. So if you're grafting back there, take this tooth out, graft this as well. So he has the red on the facial plate. So you want to be sure that you can make sure that you maintain that bone volume here. So anyway, that's this upper case. It looks really horrible. The warning is the combination syndrome. And here's where you get to practice doing sinus elevations, going through the case, which is nice to have that as a skill building exercise. If you do the sinus double bump technique, it's good practice for sure. I don't charge for 2 sinus lifts. Actually, I only charge for 1. I charge a little bit more for the Sinus Secure Sinus double bump technique, and that really just covers my cost for graft materials. So what I do is I believe that you need to get experience, and this is a great case to get experience, because you can't really mess it up too much here, where if you mess up, you're going to lose bone or opportunity to do what you want to do, which is get a foundation there, a dental implant for a broad full arch piece. So yeah, try the double bump. We talked about that in another video. It's definitely effective. I do believe that there's somebody out there that had been mentioned that does this technique too. I haven't really seen much documentation on it, but I'm sure other people are doing it. We just don't. I haven't published anything on it myself. But we've been doing it for the past maybe 5-6 years or more, 8 years. It's hard to say. And it's very effective. So in this case, he's a good healer. That should work out just fine. So once again, subscribe to us on YouTube, like us on Facebook, and check out some of our live stream broadcasts on all the channels, including Twitch and Mixer. Great. Good. Thanks, and take care. Thanks for joining.